Good morning, friends. Today I will be talking about RIRS with Manual Intra-scope Suction Technique. Urolithiasis has become a major healthcare issue due to its increasing incidence of around 10% worldwide and its recurrent nature even with the best of prophylactic care. Ureteroscopy as a primary modality of treatment has ever increasing role in management of the urolithiasis now. We all know that the complications of RIRS like urosepsis, urinoma, subcapsular and retroperitoneal collection all are related to raised intrarenal pressure and the prolonged surgery. One of the reasons for increasing operative time is a snowstorm or a snow globe effect which occurs when we start lazing. Lot of dust floating around in the PC system compromise the vision and we have to take the paddle off, and that increases the operative time. Large amount of dust that is produced during lazing tends to hide relatively the large fragments beneath the fine dust, especially at the end of the procedure. And secondly, the position of the small fragment that cannot be retrieved by the basket or other accessories are really a problem in the RIRS. So at the end of the day, it's all about inflow-outflow match. Inflow-outflow mismatch will decrease the vision, increase the intrarenal pressure and the temperature, and all the complications of RIRS may be related to this. So the only answer to this question is to increase the outflow. We have devised a technique that is called Manual Intra-scope Suction Technique, where a 10 cm extension with the 3-way is attached to the scope, and this 3-way is attached with the 10 cm syringe for an aspiration or the suction. This in turn 3-way is attached to a gravity irrigation system. My patient is a 40 years old female with right upper calyceal calculus of size of 17 by 11 by 9 mm with HU density of 1000. You can see that the vision remains clear until the time we start lazing. Once we start lazing, due to the snowstorm effect, vision is compromised, which forces us to stop and wait till the vision improves. In our technique, assistant do intermittent suction with 10 cc syringe attached to a 3-way with 10 cm extension. By this, there is a clear vision which allows us to do continuous lazing and save significant operative time which is otherwise lost due to pause during lazing. The second problem that occurs during RIRS is lot of dust is accumulated into the pelvic RSS system, and this heap of the dust hides the significant size fragments which ultimately leads to a residual calculi. We aspirate this dust using a syringe so that the most of the dust can be cleared from PC system, which allow us to clearly visualize the residual calculi. Now that the vision becomes clear and the residual fragments are visualized, they can be fragmented further into a smaller particle and dust, and the complete fragmentation of the stone can be occurred into the single stage. You can see that the vision is becoming clear and clear, and by getting a good vision. Now we will see that the stones fragments which are in the pelvic RSS system are clearly visualized. While doing popcorn, we can continuously suck the fragments inside from the pelvic RSS system so that the no fragments are left, and we can continue to popcorning till the time that the no stones or the significant stone is left into the pelvic RSS system. You can see the nice dust which is all aspirable during this process. This is a clear vision at the end of the procedure, so that even the small particles can be removed at the end of the procedures. Our technique was mentioned in the Journal of Clinical Medicine by Dr. Oliver Trexler and the group as a first of its kind. The aspirated dust can be sent for a stone analysis, and the stone analysis can be achieved. You can see the beautiful dust aspirated from the system. Advantage of our system is it's simple, it's sterile, it's cost effective, can be done from readily available equipments from OR. It doesn't require complex assembly. It is not a device dependent. It is a controlled suction and it can be stopped easily. Another advantage is it can be used even without urodal access sheath. The point is your scope is already into PC system, so the direct under vision the suction can be done, specifically useful for the lower calyces or the calisal diverticulums. This technique is particularly useful for the TFL where the snow globe or snow stream effect is significant, and for the larger stone where there is significant fragments cannot be left behind. Advantage of this system is it provides good vision throughout the procedure, decreases the intrarenal pressure by active suction, decreases intrarenal temperature by removing heated fluids, decreases the number of stages of the surgeries, and on-table clearance is possible in many cases. This procedure has a limitation like it is done manually, so required a good experienced assistant. Excessive aspiration or a suction may cause a mucosal bleeding, and if your dust is not good, channel clogging by the fragments is possible. Thank you.